So, hello everyone. Let me check, am I audible so that we can start the session? Yeah. So, yes. So, let me just check. So, this is the session of general anatomy, blood vessels. So, yes, am I audible? Okay, so yes, I'm audible and we can start the session now. So, let's move on. So, this is targeted for the first year MBBS students, and before starting the session, I would like to tell about myself, my own introduction. I am an educator of anatomy subject on the Unacademy platform. My name is Dr.Monalisa and I have got a total of 9 years of teaching experience for the various competitive exam. I have done my MD Anatomy from Armed Force Medical College, Pune. Now, let's talk about the special class features. What are the special features on the free platform of Unacademy? The features of free platform of Unacademy is that you can be the part of free sessions on the Unacademy प्लेटफॉर्म और ये बिल्कुल ही इंटरैक्टिव सेशन है. इट इज़ नॉट द वन वे. हियर द लर्नर्स एंड द एडुकेटर्स बोथ कैन इंटरैक्ट अमॉन्ग themselves. Polls are conducted which is highly beneficial, and you can ask your doubts right itself in the live session. Raise your hands and get your doubts cleared. Never ever miss a session. After completion of the session, the PDF notes will be downloaded, and that would be very useful for each and everyone. Anytime, anywhere, read from the top educators of Unacademy platform. So these are the benefits of Unacademy platform free special session. The students watching the session for the first time, they can enroll in the session by using the code ANAT10. So they can enroll by using the code ANAT10. Now let's talk about the free session which I have taken today. Just now I have completed 7 p.m. session, which is the general embryology MCQ session on the free platform. Students watching the session should use the code ANAT10. Okay, so also the 6 p.m. session was about the first year Prof examination, important questions of anatomy. And let's talk about the plus subscription. So when we are talking about the plus subscription, that means all 19 subjects can be targeted in a very systematic way. Both live and recorded versions can be assessed. You can study from India's top educators. You can compete in live tests and quizzes. You can study on the device of your choice. 25,000 MCQs can be assessed by you. That is high yield clinical MCQs, and an effective explanation is provided to each and every MCQs with the top educators of Unacademy platform. And soon, my dear aspirants, you will be provided with the printed notes of the Unacademy, and that would be highly beneficial, my dear aspirants. That would be highly beneficial for you. So go and grab this opportunity and use my code ANAT10 for getting 10% extra discount. आइकॉनिक सब्सक्रिप्शन के लिए क्या करना है? आइकॉनिक सब्सक्रिप्शन में आपको बेनिफिट्स दो प्लेटफॉर्म का है. द बेनिफिट इज ऑफ प्लस प्लेटफॉर्म ऑफ अनअकैडमी एंड द प्रेप लैडर. सो ऑल द बेनिफिट्स ऑफ द अनअकैडमी विल बी एडेड ऑन विद क्लिनिकल इंटीग्रेटेड एसेंशियल्स, video lectures of Dream Team, QBank 3, Rapid Revision, Treasure Dream Notes of 2021. Again, for iconic subscription, you can use this code and get an extra discount of 10%. Now, if I talk about the comparison of Neet PG and iconic subscription, so here in the slide, the comparison has been shown. As you can see, the pricing detail has been shown. Again, you can take this subscription and use my code for 10% discount. Now, there is an important announcement which I want to tell, that Anatomy Test Series, Study With Me Anatomy Test Series live on 21st Jan. It is live. 9 p.m. is the timing, my dear aspirants, and the rank 1st, 2nd and 3rd will get exciting prizes of 5,000, 3,000 and 2,000 Amazon vouchers, and you can get enrolled for this test by using the code ANAT10. My dear aspirants, get enrolled for this test and use the code ANAT10. You can use this code and get enrolled. The timing is 21st Jan and 9 p.m. is the timing, and the date is 21st Jan, which will be highly beneficial for you. So just grab this opportunity, dear aspirants, just grab it. I would also like to tell about Neet PG Combat. So Neet PG Combat, the questions from medicine, derma, anesthesia, psychiatry and radiology. There is a regard points from the 10 lakh rupees, which can be up to 200 rankers will be definitely provided with the subscription of Unacademy scholarship, and 50 lucky participants will get Amazon gift vouchers. So get enrolled by using the code ANAT10. till 23rd January 11 a.m. On 23rd January 11 a.m. is the timing. So get enrolled in this test. Boost your medical preparation, my dear aspirants. Just today the offer is ending. 2 years of subscription, 4 months of subscription free, with 12 months of subscription or 1 year of subscription, 2 months of subscription free. Use this code and get an extra discount of 10%. Congratulations toppers for FMG December 2021 session. I wish them best of luck so that they can target their Neet PG in the first attempt. And highly updated effective QBank containing 25,000 MCQs. Have an access to all these MCQs, my dear, for getting a better rank in the competitive exam. Use this code and take this subscription for 10% extra discount. So the batches which is starting is Target Neet PG batch, MCQ batch and comprehensive batch. Okay, done with this. Let's start with the session now. Now, before starting the actual, so today we will discuss the general anatomy. So, please mark this point that I am going to discuss the general anatomy of vascular system, not the entire histology. I will take another session. उसमें मैं histology की बात करूँगी. Vascular system means this is a system which is consist of lymphatic system and cardiovascular system. Okay, that means it includes both cardiovascular system and that of lymphatic system. ओके सो CVS की बात करते हैं तो इसमें हम किस बारे में डिस्कस करते हैं? ब्लड वेसल्स एंड द हार्ट. सो exactly heart will be discussed in gross anatomy in the thorax part. General features of blood vessels. So today target of my session is to discuss general features of the blood vessels. Okay, blood vessels के बारे में बात करेंगे. So we know that actually if we talk about heart also, it is also divided into a receiving part and outgoing part. Okay, so it is having a receiving or part and it is having a pumping part or outflow part. So each half of the heart is divided into receiving and pumping outflow. So actually receiving or inflowing chamber is the atrium of the heart, and pumping part is the ventricles of the heart, and arterioventricular septum is dividing the heart into two halves, right and the left halves, and the whole of this chambers of the heart and details we will talk in the gross anatomy. So here, before starting the session, I want to tell that when we are studying the vessels, two terms should be known to you. One is angion and the other is angiology. Okay, so the term angion, if we talk about the word, actually this is a Greek word. This is when we talk about vessels, in Greek term it is called as angion, and it means, what does this mean? It means blood vessels and lymph vessels. Okay, now my dear friends, अगर दूसरा aspect कहें angiology, so the study of circulatory, the term which is used, so angiology is defined as the study of circulatory system or lymphatic system. So write down study of circulatory and lymphatic system is called as angiology. Okay, so any of the students has got any doubt, they can write in the messages. Classification. So let's talk about the classification. So broadly we have to study the general features of important arteries. So we will have arteries which will again be divided into elastic artery, which is the large arteries, which will be divided into muscular artery. Then we have to study the concepts of arterioles. What is arterioles? What is capillaries? What is venules? What is veins? So actually these all things, general features, we will discuss in this session. So actually this is a diagram where the blood vessels types and according to the function. So here you have seen large arteries are called as elastic arteries. So actually the arteries which is emerging out from, so if you enlarge this diagram, the arteries which is directly emerging out from the heart are large artery, ascending aorta and all. These are the large arteries. Then we will have a distribution of the arteries to which is called as muscular arteries, arterioles, further branches, smaller branches, arterioles. The arterioles and venules blood are exchanged via capillaries, and smaller venules will join to form the medium veins, small veins and medium vein, and the large vein. What are large veins? They are like superior vena cava, inferior vena cava. These are large veins which is draining in the right arterial chamber. Okay, so we will discuss this, don't worry, this is just a diagram showing you the terms. अभी हमें क्या करना है, हमें details जानना है each and every important vessel. So I will discuss in detail, don't worry. Let's start with the first. So firstly, I want you to tell about the general structure of blood vessels. So if we talk about the general structure of blood vessel, it is consist of 3 layers as we move from inside to outside. Okay, अगर हम inside से outside जाते हैं तो हमारे पास blood vessels में 3 layers होते हैं in general. So if I just highlight this diagram, see here, so just me, okay. So I am just slight enlarging this diagram. So you can see here inside, as you can see, this is the lumen. So this is the lumen and this is the walls. Okay, so in this walls we have got 3 layers here. So we have got Tunica Intima, the innermost layer. We have got Tunica Media, which is the medial layer, and we have got Tunica Externa, which is also called as Tunica Adventitia. So 3 layers are there. And in the Tunica Intima, the innermost lining, we have got endothelium. So here the endothelium is lying. Then we have got Tunica Intima layer, Tunica Media and Tunica Externa. So these 3 layers are similar for vein arteries, and we have to know the separation of, so okay, so we have to know the separation. So we have to know the separation of Tunica Intima from that of Tunica Media. So see here. So you can see here Tunica Intima is separated from the Tunica Media. Tunica Intima is separated from the Tunica Media by internal elastic lamina. By internal elastic lamina. And if we see the separation of Tunica Intima from that of Tunica Adventitia, that layer is called as Tunica Externa. So that is actually external elastic lamina. So we have got 2 laminas, my dear aspirants. One is internal elastic lamina and the other is external elastic lamina. The internal elastic lamina is separating the Tunica Intima layer from that of Tunica Media. External elastic lamina is separating the Tunica Media from that of Tunica Externa. So this is the general structure of blood vessel. Now let's focus on each one of it. Let's focus on the arteries. So when I am talking about arteries, arteries can be categorized as the elastic artery, muscular artery. So each of this is important for us to know. So actually arteries are thick walled tubes that is conveying oxygenated blood from the heart and distribute it through the various parts of the body. So it is important for it to know. Okay. So arteries are comparatively, अगर हम compare करेंगे walls arteries का with the veins, so comparatively arteries walls are thicker. So they are thick walled. They are thick walled tubes that convey, what is the role? So it convey oxygenated blood from the heart and distribute it through its various branches to the parts of the body, to the body parts. So this is the function on and all. Now, if I talk about its layer of arteries, the innermost layer is Tunica Intima, the middle is Tunica Media, and the outermost layer is Tunica Adventitia. I already shown you the diagram, and we know that Tunica Adventitia को हम क्या बोल सकते हैं? It is also called as Tunica Externa. Okay. Now, here the next point arises कि यहाँ पे Tunica Intima is made of which layer? What is the most character? So actually much of detail I will talk when I will take the histology session. अभी हम general anatomy की बात कर रहे हैं, तो I will not go in much detail. I will be superficial because this is a class of general anatomy. So, but next session in the coming days, after 2 days, I am taking histology of the vessel. So where we will see so much of the histological slide, many and all the histological or microscopic feature we will talk. So here अगर हम बात करें Tunica Intima layer की, it is consist of endothelial layer, innermost. This endothelial layer is resting on subendothelial layer. What is it containing? Connective tissues. Okay. Now, Tunica Media. अगर Tunica Media की बात करें तो Tunica Media is basically consists of concentrically arranged alternate layers of smooth muscles. So it is consists of smooth muscles, concentric layers. It is consists of smooth muscle concentric layers and elastic laminas, elastic tissues and laminas, mainly 70 layers or all elastic laminas are also there. And if I talk about the external layer, that is Tunica Adventitia or Tunica externa. So here the Tunica Adventitia, the outermost layer is the strongest. Altogether we can say it is the strongest of all the layer. Why it is very strongest? Because it for having more of the strength and integrity, it will have more of elastic, it will have longitudinally arranged elastic fibers and also collagen fibers. It will also contain collagen fibers. Okay, so it will also have the collagen fibers. Got it? So these layer resist the outward pressure of the blood and prevent. So actually this strong layer is preventing the formation of dilatation of the walls of blood vessels that lead to the formation of aneurysm. तो अगर walls of blood vessel enlarge होता है या dilated होता है, तो what forms? It forms aneurysmal dilatation. So that aneurysm or formation or dilatation is restricted by which layer? Tunica Adventitia or externa. Now, my dear aspirants, please note down, in between Tunica intima and media, we have got internal elastic lamina. क्या हमारे पास है internal elastic lamina. What is internal elastic lamina? IEL in short form, which is separating the Tunica intima from Tunica media. In between media and adventitia, we have got external elastic lamina. External elastic lamina. Got it? Now, यहाँ पे further difference होता है elastic artery में, muscular artery में. So, if you will see, this is a slide of elastic artery. The elastic artery means large arteries. That means they are very large arteries, and you can see in the slide what you can observe. This is the 10x slide, and what you can observe, so many elastic fibers has been shown. So here you can see many elastic fibers has been shown, and also the three layers Tunica intima, media and adventitia has been shown, but the largest of the layer is the Tunica media layer. So if we talk about the thickest layer in case of elastic artery, we have got the Tunica media layer. Okay, also there is separation. So here you can see the separation of Tunica intima from the Tunica media is in the form of internal elastic lamina, but it is not so evident. And also there is separating layer in between the outer layer, that is external elastic lamina, but both internal and the external elastic lamina is not so evident in case of elastic artery. Now, elastic artery means large arteries, and these large arteries are like subclavian arteries, ascending aorta, common carotid artery, external iliac and internal iliac arteries, and internal iliac arteries. Abdominal aorta, ascending aorta, all these are examples of large arteries. Now I would like to show muscular artery. So when we are talking about muscular artery, here also the walls of muscular artery, when you will see exactly here in this diagram, this is a beautiful diagram. Let me slightly enlarge this diagram, so we will focus it. So if you want, I will just slightly highlight this diagram. Is it okay? Yeah. Okay, see here. Now see here, Tunica intima is the innermost layer, as you can see in the diagram. You can see this is the Tunica media, and can you see internal elastic lamina? अगर इस diagram में हम focus करते हैं तो internal elastic lamina is very nicely evident in case of muscular artery. Very nicely. तो ये आप जो देख रहे हैं, ये जो wavy line है, this is the internal elastic lamina. It is quite evident nicely. When you will see the external elastic lamina, here the Tunica media and externa, here lies external elastic lamina, and this is also nicely seen, okay, in the case of muscular artery. So internal and external elastic laminas are nicely evident in case of muscular artery because content of elastic fibers are less in case of muscular artery. Another, a very beautiful lumen is visible in muscular artery. This is the IEL, internal elastic lamina. This is EEL, external elastic lamina. This will be Tunica Intima. This is Tunica Media and this is Tunica Adventitia. Got it? Now, muscular arteries are distributing arteries. So, this will be examples like popliteal artery is an example of muscular artery, radial artery, ulnar artery, brachial artery. All these are example of muscular arteries. They are also called as distributing arteries. Now, the branches of arch of aorta and also the arch of aorta, all these are example of big arteries or elastic arteries having large lumens. See here, also common iliac artery. So see here, यहाँ पे क्या होता है, यहाँ पे abdominal aorta, you can see it is dividing into right and the left common iliac arteries. So common iliac arteries are again large arteries. Right and the left common iliac arteries are again large arteries. This is abdominal aorta and this bifurcate into two large branches, common iliac artery, which further divides into external internal iliac arteries. Okay, now also muscular artery branches, if you will see muscular artery, they are distributing artery, brachial artery, we are seeing here, we are also seeing here popliteal artery. So this is the popliteal artery which is giving 5 branches here. These are all example of muscular arteries. Now let's focus on the other term, that is arterioles. Okay, arterioles. So arterioles are actually smaller arteries will further form arterioles, and these arterioles will communicate with the venules through capillaries. So you can see here arterioles. So if we designate the approximate dimension of arterioles, the approximate dimension of arterioles will be, the approximate dimension of arterioles is less than 0.5 mm. Okay. Okay. If we talk about venules dimensions, so venules is approximately 0.5 mm diameter to about 1 micrometers. This is the dimension of its lumen. And also you can see the blood is exchanged between arterioles and venules via capillaries, Okay. Now, if you will see the capillaries, it is categorized to be of 3 types. One is the continuous capillaries, other is the fenestrated capillaries or the sinusoids. Okay, so here 3 categories of capillaries are there: continuous capillaries, fenestrated capillaries and the sinusoid, where the exchange of blood takes place. So in the continuous one, you can see there is no gap in the endothelium of the blood vessels. Okay, and if you will see the fenestrated one, there is a gap. As you can clearly see, there is a gap in the endothelium. And you can see in the case of sinusoid, there is not only gap in the endothelium, but the gap is also in the basement membrane. So there is incomplete basement membrane, and also there is gap, intercellular gap in the endothelium lining. So highly permeable structure is sinusoids. Okay, the highly permeable structure will be sinusoids. So if we talk about the examples of continuous capillaries, where is the continuous capillaries present? So continuous capillaries, which is exactly present in brain, it is present in brain, it is present in lung, it is present in skin, it is present in connective tissues and the skeletal muscle with continuous layer of endothelium. If we talk about fenestrated capillaries, which is permeable, if we talk about fenestrated capillaries, these are permeable capillaries which is having pores in the endothelium. Examples of these, actually continuous capillaries, maybe there can be exchange of certain hormones is possible, exchange of water molecules is possible, but if it is having a gap as in the endothelium, that is more permeable, and these fenestrated capillaries are seen in case of kidneys. It is also seen in cases of small intestine, pancreas and endocrine organs. My dear aspirants, the third category is the sinusites, which is highly permeable. So sinusites का example लेंगे तो it is highly permeable, and means exchange of molecules is very easily possible, and the examples are sinusites are present in case of bone marrow. It is present in bone marrow, it is present in liver, it is present in spleen. Okay, any doubt, my dear aspirants, you can ask me. So we have done with the capillaries. Moving to the next, so we have done with the common features of muscular artery, elastic arteries, capillaries and arterioles. So I just want to show you this diagram where you are seeing the cavernous tissue. So actually it is important to know actually why ये basic terms मैं क्यों दिखा रही हूँ, because this is a session where these all basic concepts about blood vessels should be clear to you before moving into the gross series. Okay, so we have not started the gross anatomy, we are in the general anatomy only. So general features should be known to you. Cavernous tissue. So cavernous tissue means the capillaries here is replaced by sinusites, and cavernous tissue का मतलब होता है blood filled spaces which is lined by endothelium. So here you can see actually this is the cut part of the penis which has been shown you. So in the penis and in the so exactly the erectile tissue of the penis, erectile tissues of the penis, and in clitoris what happens, there is a space. So these blood filled spaces which is lined by endothelium, this is corpora cavernosa of penis, as you can see here. That is exactly the definition, because there is a space for dilatations. So write down cavernous tissue. Heading is cavernous tissue. Cavernous tissues are blood filled spaces lined by, which is lined by endothelium and surrounded by smooth muscles. Surrounded by smooth muscles. Okay. Examples. It is present in erectile tissues of penis. So when blood accumulate in this blood filled spaces, they can become dilated, and also present in females in the clitoris. Okay. Okay. Now if we talk about the veins, okay, so when we are talking about the veins, so actually what happens, adjoining capillaries are, so when we will see the capillaries, these capillaries, adjoining capillaries are surrounded by smaller venules. They get surrounded by venules, and the venules will join together to form small veins. Then it will lead to the formation of medium veins, and ultimately it will lead to the formation of large veins. Okay. So veins are actually, if we talk about the dimension of venules, the venules dimension is corresponding to 0.5 to 1 micrometers, 0.5 mm to 1 micrometers. And if we talk about medium veins diameter, it is approximately corresponding to 1 to 10 millimeters. And if we talk about large veins like superior vena cava, inferior vena cava, the diameter is greater than or is equal to approximately 1 centimeter. So this is the dimension. If we talk about the veins in general, so you can see here the veins in general, they carry oxygenated blood. They are so they carry deoxygenated blood, but only one, that is pulmonary vein, which is carrying the oxygenated blood. So you can see here the veins are carrying deoxygenated blood except the pulmonary veins, and their walls are thin. Their thickness of the walls are thin in comparison to arteries, and veins also contains valves so that unidirectional blood flow is maintained. So blood can flow from superficial veins to that of deep veins. So if you will see, if you will compare the veins, you can see here, this is on the outline which is showing the muscular artery. This is the muscular artery which has been shown to you, which is having a rounded lumen. It is having a well defined lumen. It is having a well defined lumen. Okay, in case of veins, it is having a collapsed or irregular lumen. So it is having a collapsed or irregular lumen because the blood flows is sluggish in case of the veins. So veins also, let me show you another diagram. Here you can see, if we compare the arteries and the veins, is having the 3 layers, but when you will see the veins, the outer layer or tunica adventitia is the thickest. So in case of veins, please write down, in case of veins, there is absence of internal elastic lamina. Okay, and pulse pressure is also low. Why pulse pressure is low? Because blood flows with low arterial, low pressure, blood flow at a lower pressure, so pulse pressure is low. So their lumen will be collapsed. Here also you can see, this is the lumen of the vein, and you can see here clearly a rounded defined lumen is in case of artery, but the collapsed lumen is in the case of veins. And actually large vein will have so many vasa vasorum in the outer layer, so that their nutrition is maintained in case of all the blood vessels. So if we talk about the veins, so please write down certain important points about the veins. Veins carry deoxygenated blood except pulmonary veins, except that of the pulmonary veins. Thickness of the walls of the vein is less than the artery. So thickness of the walls less than the arteries. The thickness of the walls are less than the arteries. Amount of smooth muscle fibers and that of elastic fibers is also less. As compared to the arteries. But amount is less. Ma'am, are these lecture beneficial for the one who is waiting for counseling? Yes, Aditya, why not? So if you are exactly you are determined to take admission for the MBBS course, so start with the general. So only I am going to very basics. So अभी मैं जो भी sessions ले रही हूँ, अभी general anatomy के session से मैंने start किया है, and I am taking all these basic conceptual topic, very easy topic, because I know that counseling is delayed, and so I will start with the gross anatomy with the month of Feb. So no worries. So we have started in time because we want that on our Unacademy Future Doctors, all the sessions are completed before it is being completed in your college. So that is the motto of these sessions. Okay. So this will be highly beneficial for first year aspirants. Any of the topic, if you want me to repeat also, you can tell me. Okay. This is 1-to-1 study which will go on. If you are waiting for counseling also and you are definite that you are going to start your MBBS course, these all sessions will be highly beneficial for you. Okay. Amount of smooth muscle elastic fibers decreases, and there is absence of internal elastic lamina. There is presence of valve for the unidirectional blood flow. Now I would like to show this diagram. So can you see here? So what is the function of valves? Okay. So in the interior of the vein, what you can see, it is provided. So you can here appreciate also in the interior, you can see the valves are there. So in the interior of the veins, the valves are there, and the role of these valves is to present unidirectional blood flow. Reflex blood, thus maintaining unidirectional blood flow and blood flow against the gravity due to the presence of this valve. Okay. So you can see how the valves are formed. The other important point is, which is also asked in your Viva examination, Thank you, Aditya. Thank you so much. So also what I want to tell that in your Viva examination, it's also asked that how is the valves formed. So valves are formed by infolding, or you can say reduplication of the tunica intima layer. Okay. So these are certain points about the valves. So let me just write it about that. Valves. Okay. I also want to tell about the dead space. So firstly, I want to tell you about the valves. So let me rub this space, and I want to write here also about the valves. All of you please write down this basic points about the valves. Okay, interior of veins are provided with valves. Interior of veins are provided with valves that prevent reflux of blood, thus it will lead to maintenance of maintaining unidirectional blood flow. It can maintain unidirectional blood flow. This will lead to the maintenance of unidirectional blood flow. Okay. So blood, actually we know that always the blood in case of veins should move from superficial vein to that of deep veins. Okay. So at times the blood has to flow against the gravity. So blood flows against the gravity, and it is prevented from backflowing because of the presence of valve. So it can, because of this present, it can flow against gravity. So because of the presence of valves, it can flow against the gravity. And it can be also, it prevents backflow of the blood. So how is the valve formed? The next important point is how it is formed. Okay, how it is formed. So it is formed by infolding or reduplication of tunica media. It is formed by infolding or reduplication of tunica intima. Got it? So yes, we have done with this, and we have seen the diagram also. Now moving on to the next and the types of circulation, I would also like to tell you about the dead space of the vein. Okay, dead space of the vein. Next topic is the dead space of the vein. So actually large veins, when we will see the large veins are surrounded by certain dead space, so that they can, this space is there so that it can allow the expansion. So expansion of veins, it happens during increased venous return, and for example some of the veins is surrounded by this dead space, femoral vein in femoral sheath, and pulmonary vein, basically inferior pulmonary vein in the pulmonary ligament. So this is the space which is giving you the space for dilatation. So large vein, this is present in the large vein. So write down dead space of the vein. Dead space of the veins are large veins are surrounded by a dead space to allow expansion of veins, during increased venous return. Examples. So examples, where is this dead space present? Examples where these dead spaces are present, in which vein the dead space is present. The examples are, two examples I would like to give here. The one is, dead space is present in femoral vein when it is lying in which sheath? It is lying in the femoral sheath. The second is pulmonary veins to be more specific, inferior pulmonary veins, which is located in the pulmonary ligament. Now let's talk about type of circulation. So actually when we talk about type of circulation, we have got two types of circulation. One is minor or lesser circulation, that is pulmonary circulation, and the other one is the major or the systemic circulation or the greater circulation. So each loop is a closed system, and the blood is not leaking through it or leaving this circulation. So when we are talking about pulmonary circulation, the blood flows from right ventricle via pulmonary trunk. Okay, so यहाँ पे देखो, this is the pulmonary trunk, which is again, so blood is flowing via pulmonary trunk and dividing into pulmonary arteries, and then the blood is reaching the lungs. Okay, so blood flows from right ventricle to the respective lungs, and there oxygenation of the blood takes place, and back the blood will return. Thereafter the blood will return back to the left atrium via pulmonary veins. So pulmonary veins will return the blood to that of the left atrium, and this whole process is called as pulmonary circulation. So let me write it for you. The other one is systemic circulation. So yes, okay. Okay. So I will show you the diagram. Before that, please write this information. This is the basic thing. Many of you must be knowing this also. So two circulations are there, the pulmonary circulation and that of systemic circulation. So firstly, I would like to tell you about pulmonary circulation, which is also called as the lesser circulation or the minor circulation. So blood flow, in this what happens, blood flows in this, the blood flows from right ventricle, and this the blood flows from right ventricle to lungs via pulmonary trunk or pulmonary artery. In the lungs, what happens? The next is, in the lungs, we know that carbon dioxide is exchanged for oxygen, and in this case oxygenation of the blood takes place, oxygenated blood, and after that what happens, the oxygenated blood is returned to left atrium via openings of 4 pulmonary veins, So this whole circulation is called as pulmonary circulation. Okay, this whole circulation is called as pulmonary circulation. The other one was systemic circulation. So let's talk about systemic circulation, the greater circulation. Okay, so when I am talking about systemic circulation, oxygenated blood from the left, what happens, the oxygenated blood will be moved from the left ventricle of the heart to various body parts, okay, through the branches of arch of aorta and its arteries, and this circulation which is passing on to the different part, and finally deoxygenated blood is returning to the right atrium via superior and inferior vena cava. So this whole is the loop of systemic circulation. So what happens, oxygenated blood will pass from the left ventricle via ascending aorta and arch of aorta to its various parts, and will reach to the body parts and body tissue, and ultimately what happens, deoxygenated blood is returned from the body parts via superior vena cava and that of inferior vena cava, which opens into the right atrium. So this whole loop of circulation is called as greater circulation or systemic circulation. This is called as systemic circulation. Now, so we have done with the basically two types of circulation. One is the systemic and other is the pulmonary circulation. Now I told you one more circulation exists, that is the portal circulation. Okay, so this we have done, the whole of this loop, blood circulation. Same thing, if you want to see this diagram also you can understand, see here. See here, this is the pulmonary artery. Through pulmonary artery via the right ventricle, the blood will go towards through pulmonary trunk and pulmonary artery. It will reach the lung, and वहाँ पे क्या होगा, lung में oxygenated होगा, oxygenation होगा, and the blood will return via pulmonary veins open into the left atrium. From left atrium, it will reach to left ventricle via left atrioventricular orifice and valve. From the left ventricle, as you can see, it will pass through the ascending aorta. So, through ascending aorta and that of arch of aorta, it will distribute to the blood vessel. So, it will distribute the blood to whole body. The blood will reach towards the whole body. So, through the left ventricle via ascending aorta and arch of aorta and its branches, the blood will be distributed to the whole body tissue, and from the body, the blood will again via superior and inferior vena cava, it will open into the right atrium. So, this whole is the two important circulation, that is pulmonary and that of systemic circulation. So, is it okay everyone? Now, the third is the type of circulation which we are talking about is the portal circulation. Okay. So, here what happens, this is a unique circulation. Here what happens, the blood flow through two sets of the capillaries before reaching the systemic vein. So, before reaching the systemic vein, the blood will pass through two sets of capillaries. So, portal circulation. Portal circulation. Portal circulation, blood flows through two sets of capillaries before reaching to the systemic vein. So, before reaching the systemic vein, the blood is flowing through two sets of capillaries. Before reaching the systemic vein, it will pass through the two sets of the capillaries, and this is called as the portal circulation. The veins draining first capillary network. So, the veins which is draining the first capillary network. Veins which is draining first capillary network. This set of the veins and the capillary networks are the portal vein. Now, what happens? These portal vein will further branch like an artery. It is a vein, but it will branch like an artery. So, the portal vein will branch further and branches like an artery, like arteries. And this is called as second set of, this is the second set of capillaries. So, you can see the blood is flowing through two sets of circulation, which is called as is present in the portal circulation. These kind of circulation will be seen in hepatic, hypophyseal, renal portal circulation. These are where two sets of circulation occurs via two sets of the capillaries. Now, my dear aspirants, I would like to show you Vena Cavitans. You can see here the pair of veins. So, actually what happens, pair of smaller veins which will surround the capillaries and the arteries, so that their pulsations are, so actually their pulsations are transmitted to the arterial wall, and it will lead to, it will help in moving. So, what happens, this will lead to the movement of the blood flow in the upward direction. It will help in moving the blood towards the heart. So, the function of Vena Cavitans is that the pulsation of the veins which is surrounding the arteries will move the blood in upper direction towards the heart. The other function is it also maintains counter current heat mechanism. So, heat and exchange of heat takes via these pairs of veins which is surrounding the arteries. Other important features which I want you to tell is about vasa vasorum. So, outer layer of the blood vessels is containing smaller blood vessels. Actually, we have already talked that the blood vessels is having inner layer as the Tunica Intima, Tunica Media and Tunica Adventitia. Now, the outermost layer is the Tunica Adventitia, and in this outermost layer we have got smaller blood vessels. So, here you can see these are smaller blood vessels, and these small blood vessels which is residing in the outermost wall or Tunica Adventitia of the large veins. So, these are present in large veins or is present in large arteries like elastic arteries, few large muscular arteries also, and these are actually providing nutrition to the outermost wall of the vessels. Why? Actually, blood is flowing through the lumen of the blood vessels, and via diffusion nutrients is received by the layers of the walls of the blood vessels. But at times the diffusion process is not enough to provide nutrition to the outer layer of the wall. In that case, small blood vessels are residing in the outer layer, that is called as vasa vasorum. Same way, in the outer layer the nerves are residing. These nerves which is residing in the outer layer, Tunica Adventitia or Tunica externa, is called as nervi vascularis. Now, let's move on to anastomosis. Okay, so let's move on to anastomosis. Okay, So before moving on to the, so actually if we talk about anastomosis, this is of interarterial types, it is of venous anastomosis, arteriovenous anastomosis, all this I will explain. But before that, I just want to give you a review of functional classification of blood vessels. So which are the conducting blood vessels? Conducting blood vessels are large blood vessels, aorta, branches of arch of aorta, common carotid artery, subclavian artery, brachiocephalic trunks, all these are which is moving the, which is exactly acting as a conducting vessel because elastic fibers are residing. Many elastic fibers are residing it. So this is helping to distend the wall, and again the recoil happens, elastic recoil happens. So they are called as conducting vessels. So that means large vessels, elastic arteries, and all are regarded to be conducting vessel. Okay. Now, from the conducting vessel, the blood will reach into the muscular arteries, which will also be regarded as distributing vessels. Why? Because the contraction of the smooth muscles residing in the muscular artery make it as distributing channel. The other is arterioles, which is regulating. The arterioles is regulating the blood flow. So वो regulate कर रहा है blood flow को, उसको कौन सा artery बोलेंगे? Resistance artery. After that, what happens? The blood will flow in capillaries so that the exchange of blood happens between the arterioles and venules. So capillaries are regarded as exchange vessels. The reservoir vessels are the large veins and medium veins where the storing of blood happens. Approximately 70% of the blood is stored in the veins, so they are acting as holding or storing blood, so they are called as reservoir vessels. So is it okay, everyone? We have talked about the functional classification, we have talked about the structure of blood vessels. Now I would like to focus on anastomosis type. So three important categories are there: interarterial anastomosis, venous anastomosis, and arteriovenous anastomosis. These are three kinds of anastomosis which I want to focus. Okay, so let's talk about this anastomosis. Okay, so actually equal caliber of arteries के बीच में anastomosis होता है, that is important to maintain collateral circulation, that is called as interarterial anastomosis. So when I am talking about interarterial anastomosis, so when we are talking about interarterial anastomosis, this is the anastomosis which is between arteries of equal caliber. It is between arteries of equal caliber. So the example of interarterial anastomosis is, if we talk about the examples of interarterial anastomosis, the examples are, it happens in brain, in the location of brain between the vertebral artery branches and cerebral artery. These are arteries of similar caliber. Other examples also we have seen in case of intestine, we see the anastomosis between the similar calibers. Limbs may around the joint also we see the anastomosis, knee anastomosis and all between the important arteries of equal caliber. So these kind of anastomosis are example of interarterial anastomosis. Okay. Now coming to the example of venous anastomosis, that is the communication between their veins and their tributaries. So two important venous anastomosis examples are dorsal venous arches of the foot and the hand. Venous anastomosis, communications between the veins and their tributaries, communication between veins and their tributaries leads to the formation of venous anastomosis. Examples are dorsal venous arch, which is seen in case of foot and hand. I will show you the diagram also. The third, so this was the second one. What about the third one, dear? The third is arteriovenous anastomosis. So actually arteriovenous anastomosis, the term which is used for it is also called as vascular shunt. Third is Arteriovenous Anastomosis. Okay. Okay. Arteriovenous anastomosis is also regarded as vascular shunt, So this is exactly the communication between arteries and the vein. So in common terms, कैसे जब word ही arteriovenous anastomosis है तो common term में क्या बोलेंगे? The anastomosis which is formed between the arteries and the veins. Okay. So actually what happens when the organ is active? So this shunt is closed. Okay, this arteriovenous anastomosis doesn't take place, and the blood flow through the capillaries and gets circulated. But when the organ is at a resting phase, the blood bypasses the capillaries and is passing via arteriovenous anastomosis. That is called as vascular shunt. So this is the meaning of understanding of vascular anastomosis. Any doubt you can ask me. So write down. When, just a minute, yeah. When organ are generally at active stage, so when the organ is active, the shunt, this vascular shunt is closed and the blood will flow via capillaries. So that is the normal process, how the blood is getting exchanged. But the second one is that when the organ is in resting phase. So at resting phase, what happens? The normal blood flow through capillaries doesn't occur. In this phase, the vascular shunt is active and the blood flow can occur via arteries and the venous end. Okay. Now actually I would also like to show you a diagram for it actually. Okay. So I am coming to that. The first thing is that okay, anastomosis is also occurring in the branches of arteries as like the branches of coronary arteries. Okay, so as you can see here, I will come to another. These are dorsal venous arch which is seen here, the anastomosis in the vein, and the third is arteriovenous anastomosis, arteries and the veins. So naturally I just want to, one more important feature which is shown here is thoroughfare channel. So this concept is also important for you to know. Actually what happens, preferably this is used. So in many tissues, true capillaries terminates, as we know. So in many tissues what happens, the terminal arterioles and is there, and the blood will flow between the terminal arterioles and the capillaries and the venules via capillaries. But sometimes there is a side branch also there from the main connecting channel, and this side branching or the loop which is formed for communicating the blood from the arterioles and venules. So this side branching is called as thoroughfare channel. Sometimes a side branch. So sometimes what happens, there is a side branch which is also called as thoroughfare channel. There is communication between arterioles and venules possible. Okay. So we have already talked about this vascular shunt also. Now next important point is end arteries. So you have to understand the concept of end arteries. Again here I want you to give the concept of, actually we have got two types of end arteries. One is anatomical end arteries and the other one is functional end arteries. So anatomical end arteries का मतलब क्या है? आर्टरीज एंड कर गया, उसने किसी भी anastomosis में they are not taking part in any kind of anastomosis. Okay, so these vessels are terminal branches which is not anastomosing with any of the arteries which is supplying the adjacent arteries. Okay, so they are called as anatomical end arteries. Okay, functional end arteries में they are forming anastomosis, but the caliber of the blood flow through these anastomosis is not enough to maintain the viability of that tissue. So functional end arteries are present in coronary arteries. Now I have shown you the heart is having right and the left coronary arteries. So there is anastomosis between the branches of right and the left coronary arteries, but they are not helpful to maintain the viability of the tissue because the caliber of blood flow is not enough. If there is any occlusion in the main arteries, it will not lead to the viability, and they are actually there is anastomosis, but it is not helpful to maintain the integrity. So they are called as functional end arteries. So see here, branches of right coronary artery descending posterior arteries is right and the left coronary arteries are corresponding and forming anastomosis, but these anastomoses are not fair enough to maintain the collateral blood circulation possible. So they are called as functional end arteries. So let me write about these two. So if we talk about functional end arteries and if we talk about anatomical end arteries. Okay. So functional end arteries are those arteries terminal branches that do anastomosis, and they are not ending, they are anastomosing, that do anastomosis with the branches of adjacent artery, means there is anastomosis with the branches of adjacent arteries, but the caliber of this anastomosis is not enough, is insufficient to keep the tissue active or viable. If there is any thrombus formation or any constriction of the main coronary arteries. So example, if I talk about the example of functional end arteries, the example is functional end artery example will be coronary arteries. These are example of functional end arteries. Now if I talk about the other one, that is the anatomical end arteries. So in some regions what happens, the arteries do not form anastomosis and they end as, so arteries do not form anastomosis. So they are not forming any kind of anastomosis and ending there. So these kind of arteries are called as anatomical end arteries. The example of anatomical end arteries are central artery of retina. This is very important for your MCQs, my dear aspirants. ये again आपके MCQs और वाइवा के लिए बहुत important है. The list of anatomical end arteries, and the list of anatomical end arteries are central artery of retina, splenic artery, renal artery, metaphyseal artery of growing long bones, metaphyseal artery of growing long bone, vasa recta of mesenteric arteries, also vasa recta of mesenteric arteries, superior inferior mesenteric arteries, which is supplying the jejunum and ileum loop. So all these are example of also the arteries of lung, see here. So once more, central artery of the retina, vasa recta of mesenteric arteries, arteries of lungs, splenic arteries, renal arteries, and arteries of the growing metaphyseal arteries of growing long bone. All these are example of anatomical end arteries. Done? Now before ending, I would like to give you the general clinical concepts and the terms which should be known to you. This is important that you should know this topics and the names. What is it called? One of the topic is hemorrhage. So what do you mean by general terms? Hemorrhage का मतलब क्या हो गया? Bleeding हो गया, blood loss हो गया. So blood loss from the broken or injured blood vessels. So it can be either inside or outside. Blood lost inside or outside from injury. So bleeding occur from any kind of injury, either internal injury or external injury. Vascular thrombosis. What do you mean by the vascular thrombosis? That means formation of clot. So formation of clot is called as thrombosis. Formation of clot in case of veins is called as vascular thrombosis. Embolism. Now actually a sudden block occurring in arteries by the formation of blood clot is called as embolism. So it is a sudden block of arteries, by formation of blood clot is called as embolism. These are just a term to make you understand. The other is atherosclerosis. So the word atherosclerosis means, hardening and stiffening of of the arterial walls. In case of old age, it has been seen arterial wall. So this will lead to narrow of the lumen of the walls, lumen of arteries. So see here, so endothelium, subendothelials, and you can see here more of the smooth muscles, damaged endothelium is there, and there is foam cells being formed. So the lumen of the blood vessel is reduced. This will lead to the formation of atherosclerosis or formation of plaques inside, atheromatous plaques inside, which will lead to blood flow. This will lead to the sluggish blood flow, and important arteries will be nutrient derived. So nutrients deprived ho jayega, the proper blood flow and nutrients is not provided to that important drainage area of this arteries, which is blocked by the formation of plaques. Aneurysm. What do you mean by the word aneurysm? Dilatation of blood vessels. Dilatation of blood vessels is called as aneurysm, and actually it is commonly seen in case of the blood vessels of the brain which get dilated. Aneurysm is formed and rupture occurs. This can lead to bleeding, which is called as brain stroke. Also, aneurysm is common in popliteal artery. Popliteal aneurysm is formed there. Berger disease, so let's talk about Berger disease. When we are talking about Berger disease, which is also called as thromboangiitis obliterans, actually it is the result of, if there is a recurrent injury, inflammation and clotting, if there is a recurrent injury, inflammation, if there is recurrent injury or inflammation seen in the small arteries, generally the arteries of hand and that of foot is involved, and ultimately what it will lead to clotting of the blood vessels, and small or medium arteries are involved, and as you can see here, blackish coloration is onto the distal aspect of the hands, and it is more seen in case of smoker. Chronic smokers ke case mein there is more chance of Berger disease. Ramon's phenomena. What do you mean by Ramon's? See here, here the distal aspect you can see pale. The distal aspect of the digit is pale here. So Ramon's phenomena means if there is a certain spasm of small arteries. So there is spasm of small arteries, and if this phenomena occurs or episodes of spasm of small arteries will lead to reduced blood supply to that of fingers, and in the case of toes and all, it will be seeing, and that area is appearing pale, as you can see. So you can say constriction, or you can say sudden or repeated episodes of decreased blood flow of small arteries. Acute phlebothrombosis, that is inflammation of vein. This is a condition of inflammation of vein, blood clot in the vein. Now, varicose vein, actually dilatation. So we have just seen the concept of valves. If you remember, I have given you the concept of valves, that reduplication of the tunica intima layer leads to the formation of valves, which is present in veins, and this is important for unidirectional blood flow. But if there is incompetency of valve, if there is incompetency of valve, that means unidirectional blood flow is not possible, and the blood can flow in reverse direction, that is from deep vein the blood will flow to superficial vein. This will lead to dilatation of the veins, and this is called as varicose vein. And it is seen in those person who stands for longer duration of time, and if the valves become incompetent, normally it is seen in the veins of the lower limb, it will lead to dilatation of the vein, which is seen, as you can see, in the patient of varicose vein. And in long lasting cases of varicose vein, it can also lead to varicose ulcer formation. Now, hemangioma, this is a baby which is showing you hemangioma is just the benign tumor of blood vessels. So it is commonly benign, it is quite common, and blood vessels, and commonly it is seen in the blood vessels of the face. But also not only face, it can be seen in the skin, it can be seen also in the internal organs, in the bones, muscles. Okay. So I think the general concept about the general anatomy of the blood vessel is clear, and I think this session must be useful for you. I have gone briefly and I have explained the general anatomy, not gone much detail of the histological part of the blood vessels. I will soon take a session about the histology of blood vessels. Before ending the session, certain few points I want to tell everyone, that study with me with anatomy series of tests. So join me on the anatomy test series, which is going to happen on 21st Jan. 9 p.m. is the timing, my dear students, and exciting prizes are waiting for you. Rank 1, 2nd and 3rd, 5,000, 3,000, 2,000 Amazon vouchers are waiting for you. Enroll by using the code ANAT10. So get enrolled for this test by using the code ANAT10. I would also like to tell you about the Neet PG Compact Test, which is going to happen when? My dear aspirant, it is going to happen on 23rd Jan. Timing is 11 a.m. Get enrolled by using the code ANAT10. A regard of 10 lakh rupees is waiting for you. So 200 rankers, till 200 rankers. So my dear aspirants, till 200 rankers are definitely getting the scholarship of Unacademy. So just grab this opportunity, and 50 lucky participants will get Amazon vouchers. So just go for it. Neet PG Compact, 23rd Jan, 11 a.m. Use the code ANAT10 and enroll for the test. Boost your medical preparation. This is the today is the last day, that is 19th of January, by taking 2 years of subscription and getting 4 months of subscription free. Taking 1 year of subscription and getting 2 months of subscription free. Use the code ANAT10 for getting extra 10% discount. My dear aspirants, I would also like to show you this slide where the comparison has been done on Neet PG and Iconic subscription comparison. The details of the pricing detail is there, and you can go for it. Students of first year should definitely take 4 years of subscription, because their university prof exam will be cleared by comprehensive courses on the plus course of Unacademy, and also their next exam will be clear. So use my code ANAT10 for extra 10% discount. So thank you, all the best. And before ending the session, what I want you to tell, that do subscribe, like and share the channel, that is the Unacademy Future Doctors. All the best. Ma'am, should I study Gray's Anatomy or BDC is enough? Bhaumik, so I would like to answer the question of Bhaumik. So my dear aspirants, should so all the students of first year should definitely go for Gray's Anatomy Student Edition. So आपको किस में जाना है? No, Gray's Anatomy Student Edition, not the bigger one, just Student Edition. Student Edition, this is enough. So go for Student Edition, Gray's Anatomy, Snail's Anatomy for Clinical Anatomy, Snail's Clinical Anatomy, and BD Chaurasia also. Is it okay? So BD Chaurasia for your theory exam, for understanding and better concepts anatomy के लिए Gray's Anatomy Student Edition is enough, and Snail's Clinical Anatomy. Okay, and also refer good pictures from Grant's Dissector. Grant's Dissector. So is it okay, Bhaumik? Is it okay, dear Bhaumik? Welcome, my dear aspirants. All the best. Keep studying. So let's meet exactly with the new session, with the upcoming session. And so I will also tell you about the upcoming session. The next session will be of the histology of blood vessels, and so one more session is there about anatomy of the nerves, general anatomy of the nerve, which will be taken tomorrow 8 p.m. and after that, day after tomorrow, I will come up with the blood vessel histology. So this will be the topics will be covered up. Okay. So yes. Okay, Bhaumik. So okay. All the best. Keep studying. Thank you so much. So we will meet again with the new upcoming sessions. Thank you.